My name's Dr. Adigo, as mentioned, and I'm a functional medicine specialist. I have been practicing medicine for 20 years, and I've also been practicing nutrition medicine for 6 years. So I'm really pleased to be here. I feel as if I'm in my tribe. I think to get some energy going and to feel your presence, I would want to check out that I am in my tribe. So if you care about the environment, say kale. If you love animals, say broccoli. If you appreciate plants, say cabbage. Cabbage. And if you value health, say spinach. Spinach. Wonderful, thank you. I do feel at home. So, micronutrients, they are central to health. Most of us are deficient in them, but there are things that we can do in order to improve our status. So that's essentially what I'm going to be covering over the next 30 minutes or so. And then, as Rohini says, we'll then have some time for Q&A at the end. So here we have an absolutely yummy looking veggie burger. And in terms of weight, the proportion of the burger that is macronutrients is 47%. What does that mean? Macronutrients are essentially 3 types of chemicals. Carbohydrates, they are the main fuel for the body. Proteins, they are the enzymes and also the structural components of the body. And lipids, they're great for storage and also for communication through the hormonal pathways. What about the remaining 53%? Well, part of that, along with water and other additives, are what are called micronutrients. Micro meaning small, nutrient meaning something that we need in order to survive. In terms of micronutrients, the vast majority of them, we do not make them within our bodies. And so we are dependent on micronutrients in order to be healthy. Let's start with minerals. What is the most abundant chemical in the human body? I'm going to be asking you questions throughout this, so feel free to call out. I hear carbon here, calcium over there. I heard a magnesium at the back. Anyone else? Well, you all are going to be very surprised. The most common element in the body is oxygen. We did have that, I missed that. 65% oxygen, how remarkable is that? That makes me wonder whether the breatharians have got something going on that we don't know about. Carbon's the second most common element, and then hydrogen, and then nitrogen. Now, when we're talking about micronutrients, we're not talking about the elements that are present in large amounts. We are talking about the others, just at the top of the head there, although they're distributed throughout the body. So another word for these elements are trace elements, because they are present in just small amounts within the body. There are widely studied micronutrients in the literature. In terms of the periodic table, the lower down you go, the heavier the molecules become, the poorer the impact on our health. So the elements that are useful for our biochemical processes tend to be the smaller, lighter elements. So you'll see on sort of line 4 and 5, there are some heavy metals now creeping in that can cause trouble with our health. And then vitamins. How many vitamins are there? Silence. Somebody have a guess? Dozens, okay. Anyone else? 15, pretty good guess. There are 13 vitamins, essential vitamins. Now, interestingly, there are derivatives of vitamin D and vitamin K, and yet they don't appear as separate elements. So the reason the B vitamins are separate is because they're chemically distinct from each other. Whereas the variants of vitamin D, vitamin K, and the others, they are actually chemically very similar. The reason that B vitamins are grouped together is because they're water soluble along with vitamin C, but they also work very closely together in key metabolic pathways in the body. The Krebs cycle, the folate cycle, and the methylation cycle. So when I was preparing for that, and trying to understand how come the bees get special status, that's the reason why. And then moving on to phytochemicals. Well, now we blow up. There are over 10,000 phytochemicals. So phytochemicals are chemicals found in plants. Unlike the vitamins that are essential in that if you're without a vitamin for a particular period of time, you're going to run into trouble very quickly. With so many phytochemicals, it's more of an orchestration of how they impact the body. So polyphenols are probably the most prominent group of the phytochemicals. They work together, they optimize health, but they're not singularly important in the way that the vitamins are. Okay, so why are the micronutrients important? I can tell you about them, but so what? They're critical in respect to the building blocks of health. So what are the building blocks of health? Please feel free to shout out. Protein, in terms of what do you need to do to be healthy, I guess, or what are the elements that determine your health? We've just had a talk on lifestyle, so many of them are mentioned there. Exercise, absolutely. Anyone? Sleep? Hydration, absolutely. Environment, perfect. Anyone? Anything else? Nutrition, yes. One more? Stress, love that one. Okay, so yes. Your genes you're born with, but we know about epigenetics. We can upregulate and downregulate genes. Sleep, physical activity, food, stress. Stress comes in many different forms. There's a psychological stress, your community interactions, but there's also physical stress in terms of injury. The environment as well, your interaction with it. So that occurs through the gut, but also through the skin, what you put on your skin, what you're exposed to with cleaning products around the house, and what you breathe in. So air pollution, particulate matter. All of these are the building blocks of health. And the common language between them is metabolism. They all manifest their effects through chemical reactions in the body, metabolic processes. When we're talking about metabolism, there are trillions of chemical reactions that go on in the body per second. Micronutrients are central to metabolism. They drive chemical reactions because they act as cofactors and coenzymes in these reactions. They're also antioxidants, and they regulate genes in terms of the epigenetics. They turn genes on and off. So again, why is this important? Because most of us have inadequate levels of one or more micronutrient. In Europe, 40% of us have vitamin D inadequacy, and that's on the back of 90% or more of us having less than the estimated average requirement of vitamin D intake. Busy table, but what you can see here are deficiency levels for iodine, vitamin A, and iron. Now, worldwide, these are big problems, particularly in the global south. But even in the UK, we have iron deficiency around about sort of the 1 in 20 mark. But these numbers are for frank deficiency. There is a level of insufficiency that can occur where you have within the recommended range of micronutrients within the body, but you don't actually have enough for your individual requirements. So think about health is a continuum. At one end you have health, at the other end you have disease. we migrate up and down along that continuum. When we cross a certain part, then we're labeled as having a disease. And it's the same with deficiencies. It's a continuum. You don't wake up one morning and you're deficient. You have migrated there. So you go through stages before you get to the deficiency. So, the fact that we have levels of deficiency means that the numbers of insufficiency are much larger. And here we see, this is from the UK, that malnutrition is very common in the elderly. The bar at the far right are just elderly people living in the population, and we see that 15% of them have malnutrition. As you migrate towards needing more care within formal services, your level of malnutrition increases. So again, you don't wake up as an elderly person and you're deficient. That migration has occurred over time. So all of us can start paying attention today to our level of micronutrients in order to avoid deficiency and malnutrition later in life. There are different types of inadequacy. So there are the single micronutrient deficiency states. These are easy to recognize. You can measure these individually. So common deficiencies in the UK, iron, vitamin D, folate, B12. You can get these measured. You can address them depending on your results with food, with supplements. But there is another type of insufficiency, and this is a subclinical deficiency, just what I was explaining. So you've not crossed the line into having a formal deficiency, but your levels are inadequate for your individual biological needs. Often there are multiple of these going on within us, and our requirements change from day to day. So it's not a fixed state, and it's not something that you sort out and it's done. It's a continuous process of evaluating your micronutrient status and ensuring that you have enough to meet your needs. But this is complex territory that we're dealing with. There are lots of interactions that occur that determine whether your micronutrient state is adequate for your needs. This is a cell, and in the cell there are many processes that produce what are called free radicals. Free radicals are highly reactive species within the cell, and they can cause damage. But free radical production is normal as normal functioning within the cell. What happens is that we mop up the free radicals. Free radical damage is called oxidative stress, and so the types of chemicals that mop up the oxidative stress and damage, they're called antioxidants. So this is key to understanding why micronutrient deficiency is a problem. When we move from optimal tissue levels to insufficiency to deficiency, a lot of micronutrients, they're acting as antioxidants. So we talked about one of the ways that micronutrients act is as cofactors and coenzymes in chemical reactions. So the first thing that you will see on a molecular level is that reactions become disrupted because enzyme function is affected if you don't have enough micronutrients to support the reactions. But then what goes on to happen is that as well as the reactions being affected, you don't have the antioxidants you need to stop the oxidative stress and the oxidative damage occurring. So you're getting a 1-2 punch in terms of damage. I'm not a boxer, but I've heard people use that. And so your reactions are impaired, but also you've not got as many antioxidants around, and so you get oxidative damage to cell membranes and to DNA. And over time, what happens is that tissues start to break down. So there's tissue degeneration, your immune function becomes impaired, your ability to produce energy becomes impaired, organ function changes, so becoming cognitively impaired with dementia. Part of the process at play is this: your renal function deteriorating with age. This is a fundamental process that drives all of that. And then, of course, there is cell death, and ultimately, we die ourselves. So why might someone be low in micronutrients? There are three things. I mean, if you think about it just logically, you're either not getting enough in terms of the intake, or you are getting enough, but there's an issue with recognizing the micronutrients within you. Or you're getting enough, you're recognizing them, but your body's demand for micronutrients is really high, or you're losing lots of micronutrients from the body. So let's start with low intake. We live in a socio-economic society that's based on accumulation, control, and separation. And this is a key driver for micronutrient insufficiency in a lot of people. The wealth gap means that there are people on low income and they have problems with food in that the availability is compromised. There is the phenomenon of food deserts that's been described in many parts of the States in inner city areas where people, they just can't physically get hold of the food. The stores that exist are not selling fresh fruits and vegetables. Then there's the affordability of food as well when you're on a low income. All of this really lowers your food security. So with low food security, your micronutrient and overall nutritional status is going to be compromised. And then let's think about industrial agriculture. You'll notice these are systemic factors. When we talk about nutrition, often we think that we are the arbiter of our health, but really we're plugged into a wider system, a network of socioeconomics and agriculture. So with industrial agriculture, we have a system of monoculture. We grow one crop over a large period of time, or of a large space. And the way that we drive efficiency is looking at the yield of that crop on the land, and we do that by weight. And with just that continuous turnover and only replacing a handful of elements back into the soil, potassium, nitrogen, and phosphorus, over time our soils become depleted. So this is a graph that shows that over time there's been an increase in the amount of food that we're producing, but the actual nutritional quality of the food has fallen. So as I said, we're using the normal yield to measure efficiency as weight per unit of land. De Vries and et al., they have proposed a new way of measuring the productivity, which is nutritional yield. So this would be the number of adults who would be able to obtain 100% of their recommended daily requirements of different nutrients for 1 year from a food item produced annually on 1 hectare. And when you say a food item, you don't mean just one crop, but you mean a food that's produced by the entirety of what's grown on that. So that's a very, very different concept to how we currently think about agriculture and production. It's very clear that complex landscapes have more biodiversity. So when we follow monoculture, we are losing diversity. Dr. Vandana Shiva, with her organization Avdanya, they've done wonderful work in producing case studies that compare the yield, and she uses the term health per acre, the yield of growing in a multiple organic cropping system as opposed to a monoculture. Because people often think there's a misnomer that we need monoculture in order to feed the planet, and the data that Navdanya have produced shows that we actually feed more people and provide a higher nutritional quality when we do have a mixed cropping system. And then insecticides and pesticides. So how does this impact your micronutrient status? Well, On the field level, you're killing off unwanted plants, so you're lowering diversity there. And within us, we're killing off or impairing the bacteria that live within us. And the bacteria that live within us are responsible for producing a lot of the micronutrients that we depend on. So glyphosate is a type of herbicide, and it works by interacting with aromatic molecules within plants in order to kill the plants. Problem is, we have aromatic molecules within us as well, and so glyphosate interferes with those when we eat plants that have glyphosate, that have been treated with glyphosate. We're ingesting the glyphosate as well. And interfering with these molecules leads to a whole lot of problems. It disrupts our endocrine system, which is our kind of hormone communication system. It can affect our kidney function, our liver function, and it can also lead to cancer formation. There are studies that show that over time, and there have been well-known cases in the media that show the development of cancer through exposure to glyphosate. And with the disruption of all these systems, we're also adding to the oxidative burden on the body. And in that way, we're using up our micronutrients, trying to mop up all of these fires that are being started. So that's low intake. Another reason why you might have a low micronutrient status is that your body doesn't quite recognize the micronutrients. So for example, vitamin D, in order for a cell to utilize the vitamin D, it needs to recognize it on the cell surface with a vitamin D receptor. Now, because of your genetics, your receptor might not be as sensitive as the receptor for someone else. So genetics play a role in the enzymes that we create for our chemical reactions and the receptors as well. And then we've talked about overage. With oxidative stress chronically, our receptors can degenerate, and so over time we become less responsive to detecting certain micronutrients. And then finally, high demand and high loss. So water-soluble micronutrients will be lost through body fluids. If we have diarrhea, we're going to lose a lot of zinc along with others. Sweat, globally, you can lose a whole range of elements there. Tissue fluid, if you had severe burns and your burns were weeping, you'd be losing a lot of tissue fluid and micronutrients. Any source of bleeding, whether it's through your menstruation, if you're bleeding through the bowel because you have a cancer, and then kidney impairment, whatever the reason that is. Our kidneys are producing urine, but they're also very sophisticated in filtering out the micronutrients and keeping what we need. So if your kidneys are diseased, that process breaks down and you can lose a lot of micronutrients that you ought to be hanging on to. Again, genetics play a part here, as well as your genes making some of your proteins less receptive. They can actually make some of your enzymes more active than they otherwise would be. And so if you have an enzyme that's really working very fast, that pathway is going to be using up whichever micronutrients are related. And then when the body is under stress with an infection, surgery, pregnancy, after fasting, or due to toxicity, our energy expenditure goes up. And with an increase in the pathways that are occurring, the chemical reactions, there's also a high utilization of micronutrients. So there are a multitude of studies that show an improvement in outcome when you attend to micronutrient status. They relate to chronic illnesses, a whole range. These are just a scattering. In fact, I would say most chronic diseases are amenable to being modulated with micronutrient attention. Hospital stay. There are studies that show that if you optimize nutrition, people are in hospital for less time. The cost of treating them in hospital is less, and the readmission rate after they've been sent home is less. And then acute illness as well. We often think of the chronic side of things, but with COVID and critical illness, there's been a lot of studies that are looking at the role of key micronutrients in supporting people who are critically ill, and a lot of efficacy. And then just basic aging. Part of what we've talked about is, one theory of aging is it's a chronic state of micronutrient deficiency. So again, you can help yourself to age well by attending to your micronutrient status. And just one example of how the micronutrients relate to the development of disease. So this is called a methylation pathway, and at the bottom there's this protein called homocysteine. And in the pathway, in light pink, you can just see dotted around the various micronutrients that are involved in driving that pathway. So if you have a deficiency in the micronutrients, you often see that your level of homocysteine creeps up, because if that pathway is working really well, the homocysteine recycles, it's converted into methionine. But if the cycle isn't working very well, then that conversion is impaired, and so your level of homocysteine creeps up. And the effect that homocysteine has on LDL cholesterol in the body is that it oxidizes it. And when you oxidize cholesterol, it's more likely to get stuck in the walls of the vessels. So that's where you have plaque formation. So it's all kind of pathway based, but it's one example of how the micronutrients impact disease. So in this meta-analysis, they looked at 98 studies, over 20,000 participants, and they determined that by lowering homocysteine concentration, you could reduce the risk of heart disease and of stroke. Now, it's important to say that because we're dealing with complexity, there's a lot of toing and froing that happens in the literature. One meta-analysis will find X, and another meta-analysis will find Y. One study will find benefit, another will not. So when you're talking about micronutrient therapy, there are a number of things to consider. We're dealing with a system. We're dealing with trillions of reactions. We're not dealing with a single pathway. So in these studies, what else is going on in the patients? What form of the micronutrient is given, because that impacts the body's ability to absorb it. How long are patients being treated for? And then the dose of micronutrients is really interesting to look at. There's a phenomenon called hormesis, and what that means is that at low levels, there's a beneficial effect, but at higher levels, there's a toxic effect. And many micronutrients display a hormetic pattern. And so the idea is just not to keep taking as much as possible. You need to get within a sweet spot with your micronutrients. And interestingly, this can be related to the antioxidant status that we were talking about, that within a certain range, they act as antioxidants, but when you have more than that, they actually act as pro-oxidants, causing more oxidative damage. And then the other aspect as well is if studies are using levels to correct deficiency, where are they aiming to be in terms of nutrient intake? So here we have the scale of different measures of dietary reference intake. And you can see the blue section in the middle is optimal and safe. And a lot of the measures that we use are either at the margins of deficiency and what is optimal, or they're at the lower end of what is optimal. So there's a lot of room in the optimal space to expand. Some studies use higher doses because they're aiming for higher levels, but still within the safe parameter, and they might show a different result to studies that are using levels that are at the margins of being deficient and adequate. But the good news is, with this complexity, there are lots of things that you can do. It's not a magic bullet. So first off is to eat 9 to 13 servings of plants every day. Essentially, if I was to sum up good nutrition in one sentence, it would be to eat as many nutrients in as few calories as possible. And the only thing that has been shown in terms of a nutritional approach to extend life is calorie restriction. Everything else that's beneficial will improve the quality of life, will keep you healthy for longer, but it won't extend life. So if you really want to just be eating or consuming the number of calories that are adequate for your needs, you don't want to be having an excess of calories. So what this graph shows, it's a little compressed, but it looks at how much you get in terms of nutrients per calorie. And ultimately what you can see is that the fruits and vegetables give you the best bang for your buck. So you get way more nutrients per calorie for fruits and vegetables than for the other groups. Another strategy is to eat a rainbow diet. Nature's been very kind to us, and I love the orchestration in nature, but it's color-coded, right? If you have an orange, or you have a blueberry, or you have leafy greens, it turns out that plants that share a color, they have a predominance of certain types of chemicals, and those chemicals tend to act in certain ways. So really, you want to be eating the rainbow because you want to be getting a good range of all the different chemicals to make sure that you're supporting your health as best you can. And then eating a varied diet, including foraging. I discovered foraging about a couple of years ago, and I've just gone mad with it. It's just the absolute best thing. Globally, we've identified 250,000 plant species. The number of crops that we've used as human beings throughout our history to feed ourselves is in the region of 7,000. Today, 3 types of crops make up 60% of the food that we eat. So there's a whole array of plants that we are not getting benefits from because we're not including them in our diet. And this shows, this 1, 2, 3, 4, 5 pentagon shows the notion that every plant, every food type has its footprint. And so when we talk about, oh, I'm going to have protein with my meal or whatever, it's almost a nonsense because every food has all the different components in them. Some foods will have more of certain types than others. And your goal, if this is your personal pentagon, it means that it covers all the nutrients you need to be healthy. Your goal is to make sure you color this in every couple of days or whatever, so that you're giving yourself all the nutrients you need. And you do that through variety because every plant has a different footprint. And then fasting. You might think, well, okay, how is fasting going to increase or improve my micronutrient status? Amongst the many benefits of fasting, one of the things that happens is that the oxidative stress level goes down. And so you're not consuming the micronutrients you have as antioxidants, trying to undo the damage that's going on. And then other things that you can do, grow your own. Really, there's no excuse for anybody because in your kitchen, you can grow sprouts, you can grow a tray of wheatgrass. And these, particularly these two, they are packed with micronutrients. So everybody can grow and consume what they're growing. Supplementation is sometimes necessary. So, well, we know with essential B12, often with D, but even with the other micronutrients, oftentimes we might need support. And the way that we find out what support we need is essentially through getting tested and working with an experienced practitioner in order to guide you in making sure you have an optimal status. And then, of course, activism, lobbying. We've talked about the systemic factors that contribute. So, activism, lobbying to change our agricultural processes, to lower the wealth gap. These are other ways that we can collectively work to improve our status. And then returning, finally, to our building blocks for health. You can have, near perfect nutrition and you can still run into trouble. So micronutrients, food is one part. It's an important part of a bigger puzzle, but really it's important to attend to all the various factors in your life. And in that, it's not a burdensome, I've got to do this and this and this and this. It's more a kind of a richness of doing what you enjoy and where you can leverage, because there's such complexity that there's room to find what works for you in order to get the results that you want. Okay, so that's the talk over, and I'm happy to take any questions.